My name is John Wood, and I am an oral and maxillofacial surgeon. While in dental school at UCLA, we were exposed to all the different aspects of dentistry, and I found myself most amazed by the oral surgeon's scope of practice. Whether it was aligning and fixating bones to repair complex facial fractures, or purposely fracturing bones themselves to correct facial deformities, the practice of OMFS really redefined what dentistry meant to me. I feel like in dentistry, we so often become myopic and view the mouth in isolation and forget that oral health is just one part of the puzzle to our overall health and well being. So, long story short, I loved the procedures associated with oral surgery and the impact they had on patients' lives. So, from there, I decided to pursue a career in OMFS and haven't looked back since. As a maxillofacial surgeon, I've had the opportunity to treat the full spectrum of facial trauma, ranging from complex panfacial fractures where nearly every bone from your forehead to the chin is broken from something such as a car accident, to smaller injuries such as dental alveolar fractures from sports accidents, such as a baseball to the mouth. When treating jaw fractures, the broken segments are stabilized by wiring, placing titanium hardware, or a combination of the two. Understanding the nature of the fracture and the forces exerted along the fracture lines allow me to properly treat a patient and optimize his function and appearance. Oral maxillofacial surgeons are experts in treating facial trauma, including fractures involving the teeth and jaws. Our knowledge regarding proper jaw position and um, occlusion, thanks to our dental background, is critical when repairing complex injuries. It helps us ensure that after the patient heals, he's able to function properly. It's really important to not ignore injuries because if left untreated, they may result in infections, a misaligned bite, and malnutrition, amongst many things. So when the injuries first occur, prompt treatment typically results in a more predictable and idealized outcome, whereas delayed treatment may require more complex treatment that have higher risk of complications and potentially a compromised outcome. When patients suffer traumatic injuries, particularly to the face, it's a very scary incident. And I always approach these difficult situations by first acknowledging the suffering the patient's enduring. It's important to me that the patient doesn't feel alone throughout the treatment process. Many of the treatments we provide in oral surgery are, quite frankly, not pleasant, and fixing broken bones is definitely qualifies as one of them. My team and I, however, are committed to maintaining a positive, supportive environment that we think in turn provides the patient not only with a better experience, but also better healing. And I always tell my patient that half of my job is being your surgeon, but the other half is being your cheerleader. Yeah, so typically after treatment for facial trauma, patients will unfortunately feel worse before they get better. Patients will typically have increased swelling over the first 3 days and will then plateau for a day or two before steadily getting better. I always find that the first 3 days are the toughest for my patients, but I remind them that there's light at the end of the tunnel, and before they know it, they'll be feeling a lot better. To ensure optimal healing, patients simply have to do three things. One, don't chew. When you chew, you'll likely mobilize the fractured segments of the bone, and that impairs healing. Two, continue with good oral hygiene because you often have a lot of different appliances in your mouth, and keeping this clean is critical. And lastly, to ensure that you maintain adequate caloric intake that are high in fats and proteins, because you have to remember that nutrition are the building blocks for healing. If you suffered an injury to the face, whether it's from a car accident, a fall, or sports related, give our office a call so that we may begin your healing process. We're here to provide you with our expertise and experience.